Hey everyone, welcome to Taking the Pulse, a healthcare and life sciences video podcast. I am Heather Hoops Matthews, here in the studio today with Maynard Nexon healthcare attorney Matthew Roberts. Matthew, great to have you back in the studio.
Good to see you. Glad to be here in person.
We are joined today by Ira Bedenbaugh. He is the managing director for Elliott Davis, alongside Randi Branham, a senior manager for Elliott Davis. Ira and Randi provide consulting services for physicians, hospitals, and other healthcare entities on things like compensation, HIPAA and data privacy, and strategic planning and operations. Ira and Randi, thank you for joining us today.
Thanks for having us.
Thanks for having us, Heather.
We look forward to this discussion. And Randi, let's start it with you. I know you and your team represent a lot of physician practices throughout the Southeast. Tell us about that. What all do you do?
Absolutely. Yeah. So, I can speak to Elliott Davis as a whole. We do, the traditional accounting services, if you will, the tax returns, any type of tax return that, an entity may need, we do that. We do, estate and succession planning. I think, that can really come to play with physician practices and thinking about the next steps and where they go from there. State and local tax consulting. So anything really in the realm of tax is certainly something that we can practice and help entities in any way. I focus in the assurance practice. So audits, compilations, reviews, agreed upon procedures, anything like that might be required for reporting purposes or, regulators, that type of thing. And then we have accounting advisory, which is typically your interim CFO services, your month-end bookkeeping, reporting practices, that type of thing. And Ira can speak to a little bit more on the consulting side of things that we would do a span of things there.
Yeah, on the consulting side, Elliott Davis has really grown its healthcare footprint in the services that we provide. We can start with some of the ones that a lot of people are aware of: physician compensation, fair market valuation regarding those things, operational issues, HIPAA, which is a big topic nowadays with what's taking place with Change Healthcare. But, we also handle other things like financial modeling. If an entity is looking to add a service line or add additional providers, what does the financials look like? And then we're also involved in the private equity side. So we do buy side and sell side work for both entities, both the private equity side and the provider side. So we've got a full suite of services we can provide to healthcare entities.
Well, thank you guys for coming on. Ira, we'll start with you on this question. You mentioned physician compensation, and can you talk a little bit about how physician compensation models have changed over the years? Because they certainly have. And then how are we doing on the shift from volume to value-based care, and how are you seeing physicians being paid for the quality of their work and better outcomes as opposed to the volume of their work?
Yeah, Matthew, it's really changed since you and I got involved with this, hasn't it?
Oh, yes. Oh, yes.
It used to be just everybody divided equally, right? And
Right.
everybody was happy because everybody practiced the same type of medicine, right?
Mm-hmm. Yep.
But that sort of changed. And, models have sort of morphed over time. So there's more based upon the volume of work you're doing to allocate higher compensation. And now this whole concept of value-based is sort of, how do we handle it?
Mm-hmm.
And a lot of entities are struggling with it, especially right on the hospital side, where you want to compensate a physician for, I'm going to use this word, behaviors, right? So are they making sure all their diabetic patients have hemoglobin A1Cs or all these other things that have going on? Unfortunately, though, on the value-based side, an entity may not know what is going to get compensated for that work until 16 or 18, 24 months down the road, right? And what are we paying for, right? Becomes a big issue that we have to deal with. And people are struggling with how do we deal with that? There's two ways to sort of look at it. Is it risk-based, right? In which if the provider doesn't do the work that we asked them to around certain value-based contracts, do they take a reduction in compensation? Or on the other side, is it accretive, right? If the doctor does the work, then they get additional compensation. All that said, the entity doesn't know if they're not going to get that additional revenue stream until 18, 24
Right.
months later.
The predictability is much different with a value-based care arrangement, and the variability of quality. I mean, we've seen already some disputes over what's a good outcome versus a bad outcome as perceived by some third party.
Yeah, you're exactly right. And the doctors want to have confidence in the data, right? Just like you
Right.
said, it's like, wait a second, based upon my training, based upon my understanding, I met the requirements. And then the insurance company says, well, that's great, but we've got a whole different perspective on it, right? That becomes problematic. I think the other piece that Randy and I have talked about, Matthew, along these lines is how do entities, when do they recognize that revenue, right? So there becomes a revenue recognition. From a cash basis, it's fairly simple because it's just whenever the cash comes in. But Randy, from accrual base for what hospitals do, it's a different matter, isn't it?
Yeah, absolutely. It's really based on the contract terms, really how much they're going to get paid, when they're going to get paid, and then, how it's presented, whether it's net, gross, that type of thing, the timing of it also. It's really based on your contract terms. So we certainly recommend, reaching out to your accounting advisors, Elliott Davis, of course, and really trying to be on the front end of any of those contracts before they're written to make sure that the doctors, the physicians are really understanding like when that revenue should be recognized. And it's really dependent on the terms of each contract, and each contract could be very different. So there's a lot of things to kind of be involved there and to think about.
I'm going to ask you both to kind of look into the future next. All right. We've seen this continued trend of private equity, hospitals, and insurance companies buying independent physician practices. Given that, they've also been employing physicians. Given that, what do you think the future is of like a truly independent physician practice? Ira, let's start with you.
I think it's limited, right? I think the days of the true independent practice is not going to be around much longer. It's sad, right?
Very.
I used to work for 8 doctor primary care group for 10 years. So I cut my teeth in healthcare. And so I've got a heart for primary care in rural markets and private physicians. My great grandfather was a general practitioner in Prosperity. Those days of a doctor graduating from med school and doing their residency and opening up their own practice are long gone, I think. And I also think, Matthew, I'm interested in your thoughts on this, is I also think physicians don't want to run their own business anymore either, right?
I agree with that. There's there are few of them, and it's a generational issue, but not all, but most of the people coming out of programs today, residency and fellowship programs, don't have an interest in being a small business owner where they're running the practice. And that seems to be the prevailing trend.
And that's what it is, right? You're a small business owner, and we all know the complexities of healthcare, and I think most of them just don't want to do that. Now, I think it's very interesting, Heather, and you're talking about private equity. I would bet most patients don't know if their practice is private equity held or independent, right? You can't tell, right? And they can tell if they're aligned with a hospital, but private equity is you can't tell, and so they think of it as their practice is still independent, right? But it's not, and we all know that. And but I think the days are for there's probably going to be a solo position, but the groups not going to be long.
Yeah, it's hard. It's hard to see that being a future. I still think that maybe in our professional lifetimes there'll still be some, but looking out 20 years from now, when Randy's still practicing, it might be hard to find. What do you think, Randy?
Yeah, no, I kind of agree with all of that. I think Ira's point to, from the patient, you don't really know the difference. I was doing some research yesterday, even on a dental group, and just from a website, like, sure, I can see that they've got 8 to 10 locations, and so I can assume that maybe they might be private equity owned, but I don't know that. So it was kind of interesting to kind of just go out to a website and think I could find who they were owned by and that type of thing, and can't. So it is pretty interesting to kind of see that from a consumer standpoint. You can't really tell.
There's more scrutiny today on the activities of private equity companies, and you're starting to see state laws look at what they're doing in the market, the acquisition, and it's really coming. The FTC is looking at the roll-up of FQH of private equities of certain types of specialties, dermatology, and others that strategically they've been attractive. And so, you've seen some states try to look at transparency laws as who owns who, what are you doing with it from a policy standpoint, but that's certainly not widespread, not yet.
Matthew, did I see that the Department of Justice is also looking into this as well, in addition to FTC? Yeah,
they are. It's an inquiry that's been ongoing for the last year or so, and just evaluating it. And part of this is the reaction of the government to the ongoing consolidation of healthcare providers, albeit at the hospital level or the physician level, because there's concern that as healthcare providers get bigger, then that could have a negative impact on the market. I wish they had a similar concern about some of the, combination of insurance companies, because they've gotten bigger, and they have, but it's still what we've seen is the insurance company industry has gotten much bigger, and there's been a lot more consolidation.
It's sort of interesting, Matthew, because we work on both the buy side and the sell side.
Yeah.
So
right.
we work on both sides of these deals, and it's interesting the perspectives, right,
Mm-hmm.
that the sellers have and the buyers have of these deals, and both of them are unique. Both of them, you can argue both sides, right?
Right. You're exactly right. But you have to when we give advice to our legal clients on buy or sell side, the advice is very different, and the management of expectations is very different. And so it's having said all of that, what do you think? What do you two guys think the biggest challenges facing physicians, whether they're independent or whether they're working for a hospital, insurance company, or private equity? What do you think some of the biggest challenges are?
So I'll start. I think there's an information overload of physicians. And
I completely agree.
You agree with that?
Absolutely.
I was running a practice 1996 to 2006, and we put an electronic medical record in 2001. And the doctors used to be able to find, right? They knew where to find stuff in the charts, right? Now I got to look at this electronic medical record. Oh, it starts to help me understand things better. But nowadays, with the value-based contracting and all this other stuff, it's like, all right, I want to talk to the patient about their problem, but by the way, I'm getting asked to answer 20 questions related to that, so we qualify for stuff, right? And so the provider's having to deal with all this information, and at the same time focus in on the patient and what the patient is seeing, right? So
Mm-hmm.
I think that's I talk to the doctors, and I'm tired of this computer. I'm tired of answering all these questions that I'm not sure is helping the patient at all, right?
Yeah, that particularly of our generation, I think physicians feel that way because they have the prior frame of reference of being able to chart without EMR and talk directly to the patient. We know that. But Randy, how about you? What's your perspective on that?
Yeah, no, for sure. I would add, I think, technology advancements and the cost of those things are certainly a major challenge that I think practices are starting to experience, I think, across the board. Just the cost of implementing these things and how do we answer these questions and do it efficiently and maintain all this data and do what we need to do with it. So I think that the technology that's going to be needed in the future in order to save time and efforts and all that stuff is going to be, just one of the biggest challenges. And then I think one thing that I've seen on the audit side this year is cyber attacks. I think that's certainly something that is happening, and it's going to continue to happen, if not more. And, even not just the entity itself being attacked, but your service providers, or if you're, uploading claim information for a biller and the biller then, kind of goes and does the data entry for you, like that servicer can be attacked, and then your data is now out there and the patient data is now out there. So we've seen that as well. So it's even more important of when, these practices are sharing information to, a contracted service provider that is secure, like it may not be. So that's something that I think is going to be a massive challenge, to just change your mindset about how you're sharing your data even more so than before.
Right. And if you're an independent practice and a small business owner, as we talked about, and you've got to manage that risk, I mean, you've got a pretty full day anyway of everything else you're doing, treating patients. You add that, it's hard to stay committed to the long-term independent practice of medicine. There's still some out there, particularly some specialists that are doing it, but these cyber attacks, and you can have all the software you want and all the insurance that you want, it's still a major disruption when it happens.
Yeah, it sure is.
I will say my experience is similar to y'all's. I think technology has been a huge blessing to physicians, but I think it's come at a price, and I think it's become a little bit of a barrier between the physician and the patient. And it's been as we rely so much on technology and less on physicians' judgment. And in addition, I think the reimbursement system, where you have physicians spending time talking to non-physicians about their medical decision-making in order to justify it being covered for the patient, is something that I think creates some tension and with the physicians and does not make their professional enjoyment level go up when they deal with that. I think those things continue to be a trend to discourage some physicians from staying in long-term practice of medicine.
And I think you're dead on, Matthews. When I talk to them, that there's that frustration, just like you said, that bubbles up. It's like, why am I doing this? It's not why I decided to get into medicine.
Yeah, which is why now, particularly for large networks of employed physicians, those employers are using resiliency training. Obviously, COVID had a huge impact. It was very tough on particularly primary care, emergency care providers, but large employers of physicians are trying to build that into their system so that they deal with physician burnout, lack of enjoyment, or just, I guess, reduced enjoyment, because they want people to have full and long and happy careers, and it's a challenge, and employers realize that, so they're trying to counteract that in some way.
And the threat of aggressive hackers doesn't make it any easier.
Correct.
Randy, you mentioned that, just the cybersecurity issues, there's HIPAA and data privacy. What does Elliott Davis do to help specifically? You mentioned contracts, but Ira and Randy, what else can your team do?
Yeah, so we have, Heather, we have a we do HIPAA work along the assessments, policies, procedures, operational issues. But we also have a cyber team that works at Elliott Davis that works alongside us that are experts in their field. They are white hat hackers, right? And so that gives us some unique insight into their systems, right? So we get engaged to assess their environment. We also do vulnerability scanning. We also do penetration testing. And it really gives them a roadmap to sort of mitigate some risk, right? And so those are things that we do. And one of the things Randy brought up was, unfortunately, sometimes you have to look at your third-party vendors you're working with, right? And Change Healthcare is at the forefront right now.
Great example.
Right? We had a transcription company last year that had a breach of almost 8 million. And Randy's right, is you have to look at those third-party relationships, and you can do everything right on your end, but a third-party partner that you have may not, and that can be problematic. And so we also help them evaluate third-party providers along those lines. We try to bring just a real hands-on, realistic, what are the problems? And we help the biggest, weakest link is people, right? We click a email or attachment that we shouldn't have, and that's where it all gets started. And so we sort of address those issues. But Heather, it's a bigger and bigger part of the work that we do.
For sure. Very important. Very important.
I think the
Well,
quickest, oh, sorry, the
no,
easiest,
go please.
quickest thing I think people can do, especially when transmitting data, password protect it. I mean, it may not be the best solution, but it is a solution nonetheless. So it's the first line of defense if you're transmitting data across lines for any reason, whether it's a servicer of yours that you trust. I would still add that password protection, just first line of defense, if nothing else.
I know, and it makes us frustrated, but the pain of Change Healthcare,
would be a lot more frustrating.
That's exactly right.
Right.
We've got to reprogram our minds about that.
Right.
Ira Bedenbaugh, Randi Branham, both of Elliott Davis, thank you so much for joining us today to talk about just big topics in the industry. Hope you'll come back.
Well, thanks for having us. It's a pleasure.
Thank y'all. It was great.
For those of you who joined us for today's episode, we hope you learned a little bit more about some of the topics facing the healthcare industry and the services provided, at least by the Elliott Davis team. On behalf of Matthew and the whole team here at Taking the Pulse, thanks for joining us, and we look forward to seeing you next time right here on Taking the Pulse, a healthcare and life sciences video podcast.